I think I have a lot of mixed emotions about what has transpired. I mean,
Dr. William Sang is Kaiser San Diego's assistant medical director. He's coordinated their pandemic response and remembers trying to help infected patients before there were vaccinations and treatments available.
all we had at that time was putting people on a ventilation and giving them some supportive care IV.
Sang says San Diego has come a long way in 2 years, from the first cases and deaths to developing treatments and vaccines that have been proven to reduce hospitalizations and death. Right now, 2.9 million San Diegans have gotten at least one dose.
In terms of the environment, the community, if you're vaccinated and boosted, you're doing pretty good. I mean, I feel good about it, and I would have my father go out in the community now that he's boosted.
San Diego County is still seeing about 500 cases per day, but COVID-related hospitalizations have dropped dramatically from more than 1,200 in January to now just over 250.
We've done a good job, but again, there are still segments of the population that may not be getting the right information or may not be getting the full information.
State mask mandates in schools are gone next week. Studies have shown masks do reduce transmission, and Sang is worried about younger students who have not had a chance to be vaccinated yet. He points to a CDC study from last year where an infected teacher started an outbreak.
And if you look, it's directly proportional. Like all of the front row got it. Some of the second row and the people who didn't catch it were in the back row. So it really is airborne and it can't spread.
Healthcare providers are beginning to look more at the long-term impacts of COVID infections, which for some can lead to increased chances of strokes or heart attacks. Sang is also hoping more people start coming back for routine checkups.
I can tell you across the board, all the preventative measures, colon cancer screening, blood pressure screening, cervical cancer screening, all of that has come down.
This week, county health officials announced they have shifted the focus of case investigations to those most at risk, including those 65 and older. Matt Hoffman, KPBS News.